So I do wear a lot of hats. Of course, my profession, my career is to be a sports medicine physician, a doctor, team doctor, but I do a lot of other things. And I think that people are often somewhat, maybe off-put by the term physician or doctor. They can be a little professional, a little bit stuffy. That's not me. I'm an average, everyday guy with potentially above average ambition. I do have a laundry list of hats that I wear, and I think that the one that I consider the most valuable in my life is that of a dad and a husband. I'm a family man. That comes first. That's my calling in life. My career as a physician does require a lot of time and energy. It takes years of training, medical school, residency, fellowship. Those things are all in critical importance. But above and beyond that, there's the early morning meetings, the late night meetings, the chart closures, of course the patient visits, coverage of sports. I take care of semi-pro baseball, semi-pro hockey, multiple high schools, professional athletes, Olympic athletes, MMA fighters. I've worked with UFC, I've worked with Bellator. It's Justin Boots. I'm a Justin Boots pro rodeo sponsored physician, so I cover rodeos when they come to town. And then outside of that scope, as a leader in the community, I work with the Idaho High Schools Association as their chief medical officer. I work at the Mecca Gym as their chief medical officer. I help with their personal trainers so that people can have a physician's view on their training programs, their nutrition, to help with their biomechanics or whatever injuries they may have had. I also work as the state deputy commissioner for the Idaho Athletics Commission, so I oversee combat sports in our states. That requires me to write policies to make sure that the athletes are protected, to make sure that the medical clearance is appropriate and consistent across the board. I work for St. Luke's Concussion Clinic, so I'm a concussion doctor as well, and there's a lot that goes into that. Concussions are a very real problem in the athletic world that can be treated inappropriately if they're not done in a continuous manner. And then, of course, I'm involved with youth sports. I'm a coach. I coach flag football. I love coaching. I do some nutrition and exercise coaching on the side as well for clients. So I've been a personal trainer for 20 years. There are a lot of those things that I do that are just kind of average, everyday American things that other people do as well. And I think that helps me to understand my patients and to build rapport with them and be relatable with them because, on the weekends, I'm just the coach. At night when I come home, I'm just dad. So the sports that I've participated in throughout life growing up, I loved track and field and hockey and football, boxing, mountain biking, snowboarding, motorcycles, anything where I can go fast and there's a certain sense of danger and potentially a risk that I could get hurt. I like that stuff. That is enjoyable to me. Through high school, I played a bunch of sports. When I got into college, I had intention to play football at university. I had a career-ending back injury that derailed my dreams, or so I thought. I was able to recover and heal from that injury, and then I actually walked on to the cheerleading team at Utah State and got a scholarship to be a cheerleader. Not something I had ever anticipated that I would do, but ended up being a very choice experience in my life to develop me as a human. And that was a phenomenal opportunity that opened many doors for me, which actually helped me to get into medical school. Following that, I got into bodybuilding and powerlifting, as many former athletes do, because as you transition from high school sports and then university, college sports, not everybody's going to make it into the pros. And then people, I think, transition to more of the fitness type sports, things like CrossFit and bodybuilding, powerlifting. So I've been involved with bodybuilding and powerlifting for years, competed, and really enjoy that. And at this point, I think I've transitioned more to enjoying the teaching aspect of it, helping people build their bodies, whether that be for a competition or for maybe just in life in general. And I still really love the outdoor sports, things like mountain biking and snowboarding and dirt biking. Those things are all very, very much a part of my life. And I've always really enjoyed fitness and sports and athletics, but life gets busy for everybody. And I'm not to be put on a pedestal. I'm an average, everyday guy, just like everybody else who's probably listening to this video. It takes dedication, it takes commitment, and it takes a certain level of planning to make this all work. I mean, I've got a long day at work. I've got family responsibilities, and I've got these other responsibilities that I've mentioned before. but I've used fitness, I've prioritized fitness as part of my day, part of my life. You just have to make it happen. In residency, I had to work 24, 26, 28-hour shifts straight. I mean, I couldn't leave to go to the gym. I had to stay in the hospital that whole time. But I still got my workouts in. I would go work out in the stairwell. Push-ups, stairs, jumping jacks. I mean, you can find creative ways to do it. I think it just comes down to commitment. Motivation, inspiration, those are fleeting. They will come and go. But commitment and dedication, that wins 10 out of 10 times. And that's something that everyone can develop, and they can build that in their own way throughout life. It does take some time, but once you get to that point, I think it's an admirable goal and it's an attainable goal. Commitment and dedication. As I've aged, I'm creeping right up into my 40s now. I've recognized and realized that my body is changing. Things that didn't hurt as much before hurt more now. And I see that in clinic. There are a lot of patients who come in to talk to me that are saying, hey, doc, when I was in my 20s, I was hell on wheels, but I'm in my 40s now and things are slowing down. I still have it here. I still want to have it here. I still want to perform in the gym. I still want to be able to run and gun with my kids, playing soccer, playing flag football, whatever it may be. And a big part of that comes down to understanding the aging process. As we age, our hormones change, testosterone decreases, estrogen increases, throughout time. Nature is not kind to us. Like, we are not intended to live forever. And there is a degradative experience that everyone at some point in their life will feel. Might happen in your 30s, 40s, 50s, 80s, who knows? It's different for everyone, but I'm starting to feel it now as I'm creeping into my 40s. My body is changing. Things that I used to be able to do without a second thought are now things that I think twice about. And nutrition plays a huge role in maximizing your performance and your output and your outcome. And my goal in the clinic when I help patients is to help them optimize their health, optimize their wellness, optimize their performance. Wherever they're at, I try to meet them where they're at and help them to the next level, whatever that level may be. They simply may want to improve their sleep, their feelings of energy throughout the day. They may want to improve their athletic performance in the gym. All of those things are great and reasonable goals. They're the same goals that I have. I have the same goals that most people have. I want to be happy. I want to have good relationships with my family and my kids. I want to be able to be a productive member of society. And I still want to be, the American badass out there in the gym. I still want that. I still want to be those things. And I'm no specimen, but I've been able to maintain a certain level of physical ability just because I've been dedicated to my nutrition, to my recovery, to my rest, to my relationships, to my career. And I think having the right supplements are really paramount to my success because it helps me to maintain accountability, number one. I'm invested in it. And I think it helps me to optimize my nutrition. A supplement is simply that, adding to. So I want to make sure that my nutrition is on point, that my exercise routine is on point, but I'm doing everything I can to maximize that by including supplements in a way that helps me to perform at my best. Whatever that may be, our best will change through time. Your best today is not going to be your best that it was 10 years ago, nor will it be the same 10 years from now. But that's okay. That's part of life. And understanding that and having a gracious relationship with Father Time and Mother Nature, I think, is important. You don't want to fight the clock. You sort of want to accept it in a way that you're doing it on your terms. And I think that that's the message that I try to send to people when I chat with them. So talking about supplements and what's available, if you get online or you go into a supplement store, you're going to find a plethora of the Gorilla Gains 5000, right? So like there's a lot of opportunity for people who want products that help them, gain that muscle mass and size at astronomical proportions, or at least that's their intention. I think that it's marketed more towards the youthful group of people who are in the fitness industry. And I think that there's definitely room for the guys that are in their late 30s, 40s, 50s, 60s, in that they're in a different headspace. They're trying to maximize their performance, but they're not trying to bench 1,000 pounds. They don't want to go play in the NFL. They want to be husbands and dads and community members, and they want to be athletic and they want to be able to feel good and perform well, but they're not necessarily looking for the crazy, overdone, exaggerated supplements. And I think that PrimeGENIX fills the niche of that group of patrons who are potentially in that 30, 40, 50, 60-year-old age range where they probably grew up with supplements. They probably at one point in their life had that different intention. And I think that PrimeGENIX does a great job of providing a product that essentially fills the needs for that group of people where they can have the appropriate nutrients, whether that be from the testosterone boosters or from the protein powders, the fat burners, the pre-workouts. Like, they don't want it to be over the top. They just want it to be enough, and the effective and appropriate dosages of those supplements. And I think that PrimeGENIX does a great job of providing a product that does just that. It caters to that middle-aged group that, you know, they're at a different point in their life. They have different goals. They have different intentions. And that's great. That's part of life. We should accept that and be good with that. And I think that PrimeGENIX does a great job of providing that opportunity for them to have what they're looking for in the right way. So testosterone, that's a hormone that we all know about, we've all heard about. And again, Mother Nature and Father Time are cruel to us because we have it in abundance in our youth, and then as we begin to age, there's a decline in testosterone. And males feel that. It's not a good feeling when that starts to go down. And testosterone is an amazing hormone that is absolutely essential for normal growth. It helps with bone density, it helps with lean muscle mass, it helps to develop masculinity in males. And, you know, there is a time and a place where you need a lot of it in your youth. And then Mother Nature says, you know what, your procreative time has come to an end, you don't need this anymore. Not all of us are good with that, you know what I mean? And there are a lot of people that have that conversation with me that say, hey, look, I want to try to optimize my performance for as long as I possibly can. And now there's a time and a place, of course, for hormone therapy, hormone replacement, but not everybody's there. Not everybody wants to do, you know, a medication to introduce exogenous hormones into their system. And maybe they're not super low, but they're not also at the top end either. And they want to try to optimize and maximize and reap the benefits from testosterone. And so testosterone comes in, and it's an option for people. It's an opportunity for them to try to maximize their natural production without introducing an exogenous hormone or a medication. I think it's a great option for people. And I talk with them in clinic all the time, say, look, here, this is where you're at. Here's where you could be. It's worth a try. And we talk about all these options. And I find a lot of patients actually use it with their supplementation. So they'll have their hormone replacement, and they can add this as well, because the way testosterone works, you produce it through, you know, this access from the brain to the testes and throughout other organs in the system, in the body. And the way estrogen works is it creates an opportunity for the precursors to then be utilized and transferred into testosterone. So I think it's a great way to optimize and maximize your testosterone. People know about testosterone, but they don't always know about estrogen. And estrogen's a hormone in the male body that you need, but just not at too high of a level. And so people may not understand or realize that the symptoms that they're experiencing of being tired, having low libido, not having the level of lean muscle mass that they used to perhaps have in their youth, or having more adipose tissue or fat tissue that they're trying to get rid of and they're struggling to try to drop that fat. It may actually be that the problem is not that their testosterone is too low, but it might be that their estrogen is too high. So that's why when I talk to patients about, you know, trying to reduce their harmful levels of estrogen, we talk about the PrimeGENIX DIM3X, because that's a way that they can try to balance and optimize their estrogen levels. Because if their testosterone's okay, but their estrogen's too high, that may be the problem. And I think that the PrimeGENIX DIM3X is a great way to start. Cortisol is another steroid in the body that people maybe don't know about, or maybe they've heard about it, but they don't actually know what it is or what it does. And steroids in your body, that term is often off-putting for people because they don't recognize that we have lots of steroids in our body. We have cholesterol-derived steroids that are androgenic as well as anabolic, and they're created in different ways, whether that be like things like the estrogen and testosterone, the sex hormones that people know about. But we're also going to talk about cortisol, which is not an anabolic or an androgenic steroid, but it's actually something that's developed that's in more relation to stress. Having too high levels of stress in your life increases cortisol levels, and that can really wreak havoc on the entire homeostasis of the body and the metabolism, and you can develop an array of other symptoms that can be related to cortisol that are uncomfortable, to say the least. People get very tired. They can change their mood. It can change their level of energy throughout the day. And that's a difficult nut to crack, because it changes sporadically, frequently throughout the day, and can be related to your environment. It can be related to stressors at work, at home. So having an option like PrimeGENIX CortiSync is a great place to start. So I think the things that really excite me about being part of the PrimeGENIX team is the option, right? The options for people to be able to find what they want and what they need to add to their supplement routine, to add to their nutrition and their exercise regimen. Because I think that, in the end, we're all a little bit different. We're all unique, but at the same time, we all have one heart, two lungs, one mind. We all sort of progress through life. We're all trying to muddle through and do the best we can. And I want to try to help people optimize their performance and be the best versions of themselves. So of course I'm a fitness enthusiast, but as a physician, as a scientist, as a doctor, I'm really excited about PrimeGENIX because they use patented ingredients, scientifically proven formulas, and they have research to back up their claims and their ingredients. And I think that it's really helpful for me to be able to discuss those things with patients and with clients, because it helps to bring validity to the brand.